Top 10 Terrifying Ways to Go Blind. At the point when I was 23, I began losing my vision, and the specialists didn't realize why. It started guiltlessly enough, with a not exactly amazing outline perusing during a standard eye test. After a short time, I was eluded from optometrists to ophthalmologists to neuro-ophthalmologists. And nobody had a complete conclusion. At the point when you're befuddling specialists whose titles have 7 syllables, there's a problem. The experience endured almost 2 years, during which time my vision gradually decayed. Today, at age 41, it remains at 20/17 adjusted. It isn't pretty, be that as it may, as the accompanying rundown shows, things could be quite a ton worse. Number 10. Brain tumor. Mass lesion. The most alarming 2 words I've at any point perused were scribbled on a clinical cushion. I'd taken a look while the optometrist was in the other room. Potentially, I catastrophize, arranging my memorial service. I was shaken on the grounds that the eye test I'd quite recently taken unmistakably hadn't worked out positively. Affirming this, under the specialist's frightening feature were the after-effects of my visual field examination, which showed expanding scotomas, or vulnerable sides, in both eyes. The scotomas were for the most part even. The left eye's significant imperfections were in the upper left-hand quadrant, while the correct eye was for the most part affected on the upper right. The optometrist's doubt, I learned later, was that a mind tumor was pushing on my optic chiasm, a spot at the foundation of the cerebrum where our optic nerves cross. A sore causing pressure at the convergence could clarify such a respective visual field harm I was exhibiting. The visual field assessment was requested after it became obvious that I couldn't peruse the 20/20 line with my adjusted solution eyeglasses, that may be common for a more established individual. Yet I was 23. Obviously, the optometrist couldn't have the foggiest idea about this without a doubt, so mass sore was not a determination yet rather a reference. The optometrist was requesting an MRI of my cerebrum to decide if a tumor was the vision-looting guilty party. After the longest 4 days of my life, the outcomes at last returned clean. No tumor. I wasn't biting the dust, yet we actually didn't have a response for the vision misfortune. The rest of this rundown are infections I might have had, and one that I do. Number 9. Retinitis pigmentosa. Ordinarily abbreviated to RP. Retinitis pigmentosa is probably just about as alarming as it sounds. Essentially, your field of vision gradually limits, beginning with fringe visual deficiency that prompts such an exclusive focus. That burrow at that point gradually implodes, which can in the end bring about absolute blindness. The sickness is so named on the grounds that it includes a breakdown and loss of cells in the retina, the light touchy tissue coating the rear of the eye. The problem results from unfriendly changes in any of in excess of 50 qualities important for sound advancement of retinal photoreceptors, otherwise called bars and cones for their particular shapes. RP is uncommon, however not very uncommon. It influences an expected 1 out of 4,000 individuals. Considering my visual field test, those chances not, at this point, appeared long. In RP's beginning phases, victims ordinarily experience night visual impairment and a continuous loss of the visual field. Paces of movement change by individual, however most people with RP in the long run lose the majority of their visual perception, regularly so seriously that they experience issues performing fundamental errands like perusing, driving, strolling without help, or perceiving appearances and items. Fun. One of the instruments used to analyze RP is an electroretinogram, or ERG, which estimates electrical affectability in photoreceptors. Less response would mean less cells, an indication of RP. My responses were ordinary, precluding it. Number 8. Macular degeneration. Macular degeneration is the main source of vision misfortune, influencing in excess of 10 million in the U.S. alone, more than waterfalls and glaucoma joined. Also, in contrast to waterfalls, which can be restored, or glaucoma, which can be fundamentally relieved by means of treatment, macular degeneration is both serious and to a great extent unstoppable. Macular degeneration involves the crumbling of the focal retina, called the macula. The macula is answerable for focal vision, which normally requires more detail. We utilize our macula to peruse, drive, Recognize colors and perceive faces. Prognoses for MD shift comprehensively, as it can stop with apparently no clarification. Gentle cases. My experience: no clinically noticeable vision misfortune. If the illness advances, individuals experience wavy or obscured vision. On the off chance that it keeps on deteriorating, notwithstanding, focal vision can be totally lost, leaving victims with just fringe vision, fundamentally the specific inverse of passage vision. There are two essential sorts of macular degeneration: dry and wet. Dry MD, which contains 85 to 90% of cases, doesn't include any spillage of blood or serum, yet rather the gathering of yellow stores called drusen under the macula. Dry MD by and large has a superior long-haul visualization, with most holding good, around 20/40, focal vision. With wet macular degeneration, strange veins develop under the macula. Their spillage causes a protruding that can prompt quick, serious vision loss. MD is generally age-related, which means it begins further down the road. A more uncommon type of MD, Stargardt disease, 9, is found in youngsters, and has an especially helpless guess for a long-haul vision maintenance. Luckily, this wasn't my analysis, either. My macula was sound. Number 7. River blindness. At the point when you present with unidentifiable vision misfortune, specialists pose apparently little-known inquiries trying to preclude a portion of the anomalies. One of them is: have you been to Africa or the jungles lately? More ordinarily known as river blindness, onchocerciasis is an eye and skin illness brought about by minuscule worms, which are communicated through the chomp of a kind of black fly. The bugs will in general vary in quick streaming streams and waterways, thus its casual moniker. Once inside the body, the worm produces a huge number of infant or larval worms, called microfilariae, which relocate into the skin and eye. How lovably debilitating. When the microfilariae kick the bucket, they produce an exceptionally harmful compound that causes unquenchable tingling and eye sores that, after some time, can prompt irreversible visual impairment and distorting skin illnesses. Alarmingly, in some West African people groups about half of men more than 40 years old were once dazed by onchocerciasis. I had not been to Africa, Latin America or other realized pain points. It was resolved that I had not been dazed by the nibble. 6. Lead poisoning. Have you come into contact with any old lines, or paint, or drank water that wasn't fresh? There's no affable method to essentially inquire as to whether they've been eating paint chips. The specialists did, nonetheless, need to preclude the situation. As well as influencing cerebrum work, lead poisoning can have obliterating impacts somewhere else in the sensory system, including the optic nerve, which communicate pictures to the mind for processing. Through this psychological brokenness, lead harming can give an assortment of visual side effects, incorporating trouble finding in low light, haziness, and ongoing eye disturbance. It additionally brings an expanded danger of creating waterfalls. However, that wasn't a factor for somebody in his mid-20s, as I was. As confirmed by the new lead fiasco in Flint, Michigan, lead harming is still excessively normal for something so preventable. Lead has generally been utilized in an assortment of shopper items including gas, paint, create supplies, and plumbing materials. Thus the specialist's off-putting question about contact with pipes. Luckily, wide-scale lead openness in created countries is rare. Number 5. Nonarteritic anterior ischemic optic neuropathy. A frighteningly complex approach to say visual stroke. And visual stroke happens when the optic nerve encounters a stamped, unexpected decrease in bloodstream and, in this manner, oxygen. It very well may be important for a bigger stroke that influences different spaces of the body, or an independent occasion restricted to visual sensitivity. Like customary strokes, visual strokes change enormously in seriousness. The condition influences roughly 1 out of 10,000, including an unmistakable New York Times assessment essayist named Frank Bruni. In February 2018, Bruni distributed a piercing piece strikingly named "Am I Going Blind?" The passage's presentation expressively features the humiliating, unheralded caution the problem summons. They say that demise comes without anyone noticing, he composes. Lesser hoodlums have a similar MO. The burden that took my vision, or possibly a major lump of it, did as such as I rested. I headed to sleep seeing the world one way. I woke up seeing it another. Bruni depicts the vision misfortune as a thick, dappled haze influencing the correct portion of his visual field, which caused outrageous haziness as well as such a messed up feeling that left him feeling inebriated without being drunk. Ocular stroke casualties live with vision misfortune as well as a deep-rooted feeling of premonition, on the grounds that having one altogether raises the probability of enduring another. Bruni announced that, over the course of the following 5 years, he confronted a 20% possibility of a comparable occasion in his excess great eye. All in all, he has a 1 out of 5 possibility of turning out to be practically blind. The example of my vision misfortune, nonetheless, didn't propose a stroke. While it stayed possibly on the determination agenda, specialists continued looking for a likelier suspect. Number 4. Devic's disease. One of the problems that most firmly reflected my visual side effects was, unsettlingly, among the most terrifying possibilities. Otherwise called neuromyelitis optica, Devic's disease can be genuinely portrayed as numerous sclerosis on steroids. Outwardly, while MS will in general assault only one eye with optic neuritis, wordy flare-ups assaulting the optic nerve, Devic's disease ordinarily gives considerable scotomas, vulnerable sides, in the 2 eyes. My vision misfortune was two-sided, the 2 eyes, and a neuro-ophthalmologist affirmed my optic nerves were more slender than ordinary. In layman's terms, the cameras, my eyes, were fine yet the links were frayed, essentially obscuring the feed. Devic's is, just, merciless. Like its cousin, MS, it is portrayed by insusceptible assaults on the optic nerves and the spinal string. Not at all like MS. Devic's will in general loot enormous pieces of both vision and portability all of a sudden a backslide, transmit design that impersonates MS yet with additional incapacitating scenes. Contingent upon which segments of the optic nerve and spinal rope are influenced, side effects can remember visual deficiency for one or the 2 eyes, shortcoming or a loss of motion in the legs or arms, agonizing fits, loss of sensation, while spewing in bladder or entrail brokenness. An MRI of my spine returned uncertain. Tragically, the subsequent stage was vastly more difficult, a spinal tap. The liquid was typical. No MS or Devic's. Not yet at any rate. The pursuit proceeded. Number 3. Coloboma of the eye. Gotten from a Greek word signifying abridged, colobomas 16, include a bunch of conditions wherein typical tissue in or around the eye is missing from birth. This can incorporate fragmented arrangement of the macula, focal point, uvea, optic nerve or, strangely, the eyelids. Visual debilitation can run the range from for all intents and purposes asymptomatic to basically visually impaired. Whenever affirmed, mine would be a moderate instance of the optic nerve assortment, which includes a strange optic path that is fairly exhumed or dug out. In spite of the fact that it is available from birth, it's normal for gentle or moderate cases to go undetected until youth or early adulthood on the grounds that, as a specialist disclosed to me, you can just see the world through your eyes. My helpless vision was typical to me. It took failing some eye tests to show me it was certifiably more regrettable than normal. All over, the thought of a birth imperfection appeared well and good, as my mom experienced toxemia, a condition that can cause perilously hypertension while conveying me. Indeed, after 3 years, during her subsequent pregnancy, she passed on from it. Preeclampsia can interfere with oxygen to hatchlings, bringing about birth abscons. In any case, more generally colobomas are hereditary, and there wasn't proof of them running in my family. With no formal demonstrative test, another infection was added to the perhaps section. It was decent perhaps, in light of the fact that colobomas commonly don't deteriorate. Number 2. Leber syndrome. Authoritatively called Leber hereditary optic neuropathy, Leber syndrome is a mitochondrially acquired degeneration of retinal ganglion cells and their axons, long thread-like nerve cells reaching out to the optic nerve. While it commonly influences young fellows, LON is acquired maternally, since we get mitochondria exclusively from our mom's eggs in the belly. Leber normally gives intense beginnings of visual misfortune, first in one eye, at that point the other half a month later. Nonetheless, In 25% of cases the vision misfortune can happen in the two eyes all the while. The issue at that point decays to extreme optic decay and a lasting reduction of visual sharpness. In the intense stage, influenced eyes show a liquid-filled appearance of the nerve fiber and amplified or in any case harmed peripupillary vessels. A pupillary imperfection additionally can happen, as the eyes battle to catch all the more light. Notwithstanding respective keenness, I had two different indications that alarmingly lined up with Leber's, hindered shading vision and the particular areas of my scotomas, vulnerable sides. Mine were secocentral, which means they started from the common little vulnerable sides we as a whole have, where the optic nerve interfaces with the eye, and broadened dramatically after some time. Had I had Leber's I'd probably be almost visually impaired at this point. Fortunately, I didn't. Number 1, dominant optic atrophy. After right around 2 years of vulnerability, the specialists showed up as such a determination by cycle of disposal, dominant optic atrophy. Also known by its disrupting abbreviation, DOA, dominant optic atrophy is a somewhat approximately characterized condition portrayed by degeneration of the optic nerves. The expression prevailing insinuates its innate nature, a piece of information to specialists in light of the fact that my dad has had gentle instances of optic neuritis, inflammation. DOA normally begins during the main decade of life, with influenced individuals often creating moderate visual misfortune and shading vision abscons. Its seriousness changes broadly, a typical issue with eye problems that additionally makes them more hard to pinpoint, with visual keenness going from close ordinary to lawful visual deficiency, which is 2200 corrected. Dominant optic atrophy stays somewhat of a clinical secret. It very well may be brought about by a transformation in any of a few qualities, some of which have not been distinguished. Like most eye illnesses, there is at present no real way to forestall or fix it. Tragically, DOA additionally has a blade of Damocles angle to it, which means it can stop and restart abruptly. Fortunately, it's been over a long time since I've endured any certifiable vision misfortune. In any case, the possibility of losing a greater amount of my valuable visual perception will, similar to my sick optic nerves, be in my mind for the remainder of my life.